Hello everyone, thank you so much for being here this afternoon. It's my absolute pleasure to come to this conference today. It's my first time to the conference, and I'll be discussing a bit of a different take from Kaylin's presentation, which is looking at the kind of utility of a portable low-field MRI system in detecting structural brain changes in older individuals with HIV. So to recapitulate some of the kind of key statistics that have been discussed obviously throughout the conference thus far, over 53% of people with HIV over the age of 50 years, these rates are predicted to exceed 70% by 2030. Sorry, I don't have my glasses on, I'm just realising. Approximately 19% of people with HIV over the age of 60 may develop age-associated dementia by 80 years old. This contrasts with around 15% in the general population. Now, classification of cognitive impairment in individuals with HIV should consider a combination of both cognitive symptoms and low performance on cognitive testing and abnormality on neurological investigations. And one of the key tools, again, as Kaylin so eloquently discussed prior, that we have in obviously looking at structural changes in the brain is magnetic resonance imaging. Now, an image here can be shown from an individual without HIV or cognitive impairment, where we see kind of structural integrity of both global kind of structures again, grey matter, white matter, and indeed the subcortical structures as well. Comparatively, we have in individuals with HIV and cognitive impairment, we can have both regional and global atrophy in certain areas, such as the caudate. And this compares with individuals with mild cognitive impairment due to suspected Alzheimer's disease, where we have both global atrophy again, where we have significant atrophy in both the cortical thickness and the white matter, as well as this kind of the subcortical structures where we get enlargement of the ventricles. Now, although MRI is incredibly valuable in detecting early onset of cognitive decline, and this was discussed kind of really importantly in one of the sessions earlier today, in how can we look at trying to actually diagnose these older individuals with HIV with cognitive impairment before onset of these kind of symptoms or being brought into the clinic, for example, by their family members. So MRI is a valuable tool that we have to do this, but it's not readily accessible. Now, that includes both regionally here in the US and obviously globally worldwide as well. Sorry. And there are several kind of barriers to this or kind of underlying causes for this, and generally this is around the magnetic field strength of these devices. So they operate at very strong magnetic fields. Because of that, they have to be contained within the shielded rooms. They have to use helium, biggest use of helium in the world, which I always find fascinating. And they need to be kept cold, obviously, to operate. And they have a huge power requirement. So we kind of liken this to the power requirements of operating an individual home. All of these things lead to a significantly greater cost of both device purchase, and in the realm of millions, and of device maintenance. However, one kind of new technology that's come out, actually it's a very old technology, it's kind of the basis of MRI originally in the in the 70s, is this leveraging portable low-field MRI. Now, these devices operate, as the name suggests, at a significantly lower magnetic field strength compared with those conventional systems. Now, these things together mean that the devices are portable, they're lightweight, they can be driven around the hospital, taken to the patient room, taken in a kind of more remote and rural settings. They don't have the same shielding requirements because they are a much lower magnet. I like to say again about 10 times as strong as a fridge magnet when we're speaking with patients. And these features lead to a significantly lower cost. So the goal here is that if we could utilise this technology, could we improve access to neuroimaging, and how might that facilitate long-term earlier identification of individuals with these brain structural changes in the absence of obviously coming in with these kind of cognitive complaints. Now, one of the challenges of low-field MRI, as the name suggests, is this is a beautiful image, again, of this crisp, lovely high-field MRI where we see gorgeous structure of all the brain regions, is that with the inherently lower magnetic field strength, it leads to a reduction in image resolution. So you can see here in the left image, this is a typical T1MP range structural image that is like a 1 by 1 square or cube pixel. In comparison, the middle image is an image example of the low-field MRI, where it is almost like a rectangular pixel, if that makes sense. And those things mean that it can lead to less accuracy in volumetric segmentation, which is a really important, again, as Caitlin so beautifully discussed, is looking at those brain structural changes. However, what we can do kind of more recently is look at leveraging different machine learning pipelines to see how we can extract some of the information from these lower resolution images to improve the resolution again, so to make them that 1x1 kind of pixel size, and how then that might allow us to segment these brain volumes more accurately, and again, look at these changes over time and detect any kind of differences. And this really importantly, in improving this again, allows us to look at these structural differences. So on the spinning brain on the left, this is looking at the white matter and grey matter you can see in 3 dimensions. And then on the right, we can see, again, these subcortical structures. So this is looking at the areas such as the hippocampus, putamen, and caudate. So the main objective of the study was we wanted to assess the accuracy, first and foremost, of this low-field MRI in measuring brain volumes in people with HIV and investigate regional brain atrophy in comparison with age-matched comparators. So the first aim that we wanted to do was to look at the accuracy of these volumes derived from low-field MRI against conventional high-field counterparts. So how well do they correlate with one another? And then secondly, we wanted to examine the patterns of brain atrophy in these individuals with HIV compared to individuals without HIV, but with mild cognitive impairment, and those without HIV and without any evidence of memory complaints. So we had 3 main groups in our inclusion criteria. So first, individuals with HIV, and they're on antiretroviral therapy over the age of 40. We then had individuals without HIV, but with mild cognitive impairment and due to suspected Alzheimer's disease in this instance. Then we had individuals without HIV, but and without memory complaints, but with more than 2 vascular risk factors as a comparator in this cohort. Exclusion criteria, we can safely scan individuals with passive implants, such as hip replacements, etc. That's all fine, but we still, just for extra safety, we don't scan anyone with any electronic implants, like a pacemaker. And also, pregnancy and weight exceeding 400 pounds. And for us, all individuals that were enrolled in the study underwent a portable low-field MRI acquisition in the neurology clinic at the Mass General Hospital, and this operates at a field strength of 0.064 Tesla. Then finally, we processed the images through a freely available machine learning pipeline called FreeSurfer, along with our collaborators at the Martina Centre, and this is called WMH-SynSeg, and allowed us to derive these brain volumes of interest. So just quickly, our initial demographic of our study population. So for our individuals with HIV, we selected this to be representative of racial and ethnic minorities, a population in Suffolk County of Massachusetts. So this was a targeted N of 30 individuals with 33% female, almost 70% male, 50% white, 40% Black or African American, and 26.7% Hispanic or Latino. Our individuals without HIV but with mild cognitive impairment were comparable in age, were 50-50 male and female, but were entirely white, so not as representative of the population, unfortunately, in this instance. And finally, our individuals without HIV and without memory complaints, again, a similar age and a similar kind of split of male and female. So again, just to reiterate, our first aim of this study was to determine the accuracy of this low-field MRI, these derived brain volumes, compared with conventional high-field MRI. And what we can see here, so really what we wanted to really see is, because this super resolved image is obviously, it's introducing new data, it's kind of this beautiful crisp image, but we want to make sure that the volumes that we derive from that are comparable to these pipelines that would come out of a normal standard conventional MRI. So this is looking at the white matter and the grey matter, and what we found is that we had strong correlation for both. This was in an N of 12 as initial proof of concept. And similarly, when we extrapolated this kind of findings, we wanted to look at these subcortical regions, again looking at the caudate, putamen, and hippocampus in particular. We found a strong correlation between the putamen and the hippocampus, and slightly less strong, but still reasonable, in the caudate. Next, we really wanted to see, okay, in this population, we've established that we have quite strong agreement between the low field and high field counterparts. Now using just low field imaging, how are we able to use this tool to differentiate between these different populations, and what do these brain regions that we're interested in, how do they compare with one another? So first, let's just step through this a little bit slowly, but we looked at obviously individuals without HIV and those individuals without HIV but with mild cognitive impairment. And what we found is that we had a trend towards a reduction in the white matter, as you would expect, a significant in the individuals with mild cognitive impairment due to suspected Alzheimer's. Similarly, we had a reduced grey matter volume or cortical volume. This isn't cortical thickness, but overall cortical volume. Similarly, we had a reduction in the volume of the caudate and a really significant reduction in the volume of the hippocampus, again, as you would expect to see in individuals with suspected Alzheimer's disease. We did not see any differences, however, in the putamen. However, when we looked at individuals with HIV without memory complaints, we saw for the white matter that we had a decrease in the volume of the white matter. We didn't see any differences, however, in the volume of the grey matter, which was interesting, compared with the individuals without HIV. In the caudate, however, we did see a significant reduction in the volume of the caudate and even a trend towards a reduction compared with those individuals with mild cognitive impairment. But interestingly, we didn't see a difference in the volume of the hippocampus in this cohort. So we did see a trend towards a reduction, but not as significant as what we saw in our individuals with mild cognitive impairment due to this suspected Alzheimer's disease. And finally, we didn't see any differences in the putamen in this cohort. So just to summarise, again, thank you for listening, everyone. But what we found in this study, we did this over quite a short timeline. We began enrolment in the beginning of the year, so we managed to enrol 30 individuals over 6 months. And we found that this was feasible to recruit these individuals, and we were able to recruit successfully a representative population of older individuals with HIV for neuroimaging research. We then were able to apply this machine learning pipelines to quantify brain atrophy on low-field MRI, and we demonstrate a strong agreement with conventional counterparts. We also found, again, just to summarise, the volume differences that we saw, that we were able to see that we had subcortical tissue loss in a manner that was comparable to individuals with mild cognitive impairment in the caudate and the white matter, but differences were not seen in this cohort between the hippocampus and the cortical grey matter. One caveat to this, that's an important limitation to acknowledge, is that this cohort of individuals with HIV was a general cohort. It did not specifically target, in this instance, cognitively impaired individuals. We would really value for our future analysis to provide a more in-depth analysis of cognitive function, so using some more robust kind of cognitive evaluation tools, and phenotyping of cognitive subtypes. And hopefully Ready Health monitoring through portable MRI may facilitate early detection and monitoring of atrophy in the future. So thank you so much for your time, everyone. Thank you to my mentor, Shabani Mukherjee, who let me come along today, and I'll be happy to answer any questions at the end. And thank you to patients and all our collaborators. So thank you so much.